All right. Hello, everyone. I'm Dr. Eric Broadworth. I'm going live right now. First ever session for Ask the Doc with currently just myself right now, but here to answer any questions that you may have. I want to do this series Monday nights at 8 as of right now. In the future, just some things that I might be doing is hosting with other people, other professionals in the area as well. So just some things in the future to keep a lookout for. So going to go over right now just some common questions that I get every day as a physical therapist on how to help people and the questions that they have. So I've got 3 questions that I'm going to answer that most people ask me. And then if you have any questions, feel free to comment and I would be happy to answer them for you. So we'll start off with a pretty common question that I get is ice versus heat. So a lot of people, when they come in, they will ask, what is better? What should they do? Should they ice to treat their pain or should they use heat? Pretty common, basic question that we get all the time. And the research is actually pretty mixed on this, on which is more beneficial, ice versus heat. So with ice, it's actually, a lot of people have actually, you'll hear some people say that icing is bad and not to ice at all. What I tell people is usually within the first 48 hours, you can ice to help decrease any swelling that you may get with the injury to help decrease some of that inflammatory response. Now, why some people would say don't ice is because that inflammatory response is natural and that you do need that inflammation to help promote tissue healing. I really don't think it's a bad thing to ice in the first 48 hours and just to decrease pain and control that inflammation so that it is comfortable and it is more manageable. So, it can be a little bit of personal preference there. Now, after 48 hours after sustaining an injury, really it's personal preference. So some people really like ice and that seems to help control their pain. Some people like to do heat and some people like to do a mixture of both. There's really no right or wrong answer. I like to tell my patients, if you find that one or the other is more comfortable, go for it. If you're going to ice or heat, you can do either for 20 to 30 minutes at a time and do that a couple times a day. A lot of times, at the end of the day, at the end of a long day, you might have a little more inflammation or a little more pain simply because of the day's activities, and therefore that modality may feel better. However, either way, with ice versus heat, all it is a modality. That is it. It is not going to fix your injury or cure you. So just something to think about there is it is a modality. So that's all. With heat, you might hear people say that heating can help the muscles relax by heating up the muscles. In order for you to actually change the temperature of the muscle, it's got to get really hot. And you're not going to do that with moist heat. You're not going to do that with a hot pack. You're going to get more of a nervous system response, which is going to get you to feel good and maybe get your muscles to relax a little bit. So again, all that is a modality to help control symptoms. And really, then what I tell people afterwards is the magic is in the exercises, the home exercise program, and also using manual techniques as necessary to help decrease pain. So next question that I get a lot is regarding pain medication for low back pain. Now, I'm not a physician, so I'm not going to, hey, Dad, hold on. Okay, we'll bring you on just a second here. Bringing on Dave Broadworth here onto live. Don't know what to expect here. And it says it's adding. Says it's adding you, but I'm not really sure what's going on. So, meantime, oh boy.
Yeah, I wasn't planning on coming on. I was just going to ask a question.
Okay. What's going on?
All right. So, as you know, hip replaced 10 months ago.
Yep.
And last week, for about 4 or 5 days, and even behind my knee has been sore. I don't know if it feels more like tendons or something. I'm not sure. But then kind of sore yesterday and today up around the hip area where the replacement was. Should I be contacting the surgeon or should I just be thinking physical therapy? What are your thoughts?
So, so how long's the soreness been going on? And you said it's in the back of the hip as well as behind the knee.
No, it's just behind the knee, but
How's it
then
going,
like
Adam, Martin, Daryl?
today it was kind of, or this morning kind of up near the where the hip was replaced. And I also
Mm-hmm.
noticed today when I left the gym, my right foot's kind of turning out a little bit. And I don't know if that's been happening before, but I know that when I went to physical therapy in January and February, they were working on my knees and stuff a lot, trying to get everything straightened out.
So yeah, so following a total hip replacement, I mean, you had the anterior approach. So you said you're getting some into the into kind of the buttock area or in the back of the hip.
No, no,
Um,
down just in the back. It's down at the knee area
okay.
and
But then
above
in
the
the
knee.
front of the hip, where you said the hip replacement was, correct?
Just lately the hip replacement, but and up in the anterior area.
Yeah. So, um, I guess my questions would be, have you been walking more? Have you been exercising more? Have you been doing anything different? Um, odds
Yeah.
are that nothing. What?
Yes.
So
I've
yeah.
been on the
So
yeah. Last week I was on the treadmill a lot more. Uh, you know, in fact I ran maybe on the treadmill. I might have ran. Uh, I don't know. It's only for like 2.5 minutes. So I mean the tenth of a mile, but not a fast
so when
pace, and it
was
was a light run really.
so when was the last time you ran before that?
Uh, before my a year before my hip surgery.
Okay. So I think that really kind of hits the nail on the head to me anyway, is that if you're exercising more, part of it could be if you haven't exercised in a while and now you're getting back into it, if you're overdoing it, you might be getting a little bit of muscle soreness. You might also be doing exercises wrong a little bit. So I don't think there's anything to necessarily worry about in the front of the hip. It's very rare that anything actually goes wrong. Now, if the leg is permanently turned out to the side, that's an issue. That's a sign of a joint dislocation or loosening. That'd be typically pretty painful though too. Now, if you can rotate the leg back forward, that's typically not something then to worry about. What sounds like to me is that you have weakness in the hip still, and that's why your hip's rotating out to the side and you're pointing out. And then the front of your hip's probably hurting because you're overcompensating with your hip flexors. Your hip flexors are probably pretty sore and irritated. So um, I would be making sure you're doing a lot of the bringing back in some of the exercises that the PT gave you. So for glute strengthening, maybe bring back in some straight leg raises to help with that hip flexor strengthening. And then as far as like with like I said, the leg turning out, really making sure you're stable when you're doing the exercises. I don't think that's anything to contact the physician right away for. But if it's something that's bothering you, definitely getting back into physical therapy isn't necessarily a bad idea. And that way too, so they can give you a program to stick with. So you'd really want to make sure, though, that you're seeing, I would say, uh, someone who also has a strength and conditioning specialist certification with that, or someone who's knowledgeable and experienced in giving people, a pretty good exercise program following PT, and um, not just the simple exercises that you'll kind of then, go away from. And some places will even set up where you can work with maybe like a personal trainer that works with the physical therapist, and then you're not having to necessarily go to physical therapy if it's not necessary, but you're there under the PT's watch as well. So they usually work pretty closely together.
Cool. Yeah, the foot's not turned out very much, but it's just something I noticed when I was leaving the gym this morning. It's turned out, maybe like to 1 o'clock, if that. It's not like it went really far turned out. I mean, I've seen
Yeah,
people
yeah,
walking down the road that their foot's almost sideways. It's nothing like that. It's just barely.
yeah, that would be definitely more of a concern, in which case you might be looking at a botched surgery, but it does not sound to me like you have a botched surgery by any means. I think you need to be more consistent probably with your exercise program, more consistent with going to the gym. I would tone it down in terms of the jogging and maybe do like 30 seconds on, 30 seconds off instead of trying to jog for 2 minutes, and then build up from there and maybe go up to 1 minute after, if 30 seconds is easy, and then 2 minutes, and that's from time to time. So you could do 30 seconds on, 30 seconds off, or even 30 seconds on, a minute off for like 5 to 10 minutes. See how that feels. Does that make
Sounds good.
sense?
Yep.
Cool.
I don't know how to
Cool.
get the camera up. I'm never gonna come on live with two people.
I don't
Be
know
good for
either.
doing
I
my
mean,
videos.
this is a first time thing for me. Right now, it looks like I'm pressed like an
Well,
X thing.
here we go.
And you just went off there, but I was just going to tell you, I also just before this accidentally bought Fleetwood Mac tickets. See, Fleetwood Mac, Jess right now is trying to uh, get me my purchase back. So if you're on Facebook and looking at concerts, this is completely off topic from physical therapy, but be careful on what you press, because I didn't even press like confirm, and next thing I know, it's like, oh, you have Fleetwood Mac tickets. So hopefully I can get my money back for that. If not, I don't think I'm muted. Can you hear me? Well, if you can't hear me, let me know. I'm gonna keep going though. So next thing I was gonna get into was pain meds for low back pain. You see these days a lot of people saying that they need narcotics or a pain medication or something like that to control their back pain. It's actually been proven in the research to be pretty ineffective, and in fact, very ineffective at controlling low back pain. So best way to fight low back pain is through movement, through exercise, through conservative measures that are not, necessarily surgery and not necessarily low back pain. So that's something that you can see a physical therapist for. I know some people go to chiropractors for that. That's, fine too. I would just make sure that you're doing your research on whoever you're going to see and make sure that they're a qualified specialist to see you. So a good type of physical therapist to see out there is an orthopedic certified specialist. Those individuals actually have had superior outcomes when it comes to treating low back pain in the research when compared to other physical therapists and other specialists conservatively. So last question that I usually get here is, do I need a referral for physical therapy? So the American Physical Therapy Association has been fighting for patient rights and advocating for our profession for a while. And I believe it should be in all 50 states now that you do not need a referral for physical therapy. Now, where I'm at in Michigan, we do not need a referral for physical therapy. Now, Medicare has a little bit different rules, but you do not need a referral for physical therapy. You can go straight to your physical therapist and skip trying to get into the doctor's office to get a referral to then go to physical therapy, which is it's huge for everyone. It's huge for the physical therapists. It's huge for the patients, because usually the longer you wait to get in, the harder it is going to be to treat. And the quicker you get in, usually the quicker results you can get. So I tell people, if it's been 2 weeks and you're not noticing any improvement, it does not hurt to get in right away. Go see a specialist. See what you can do for your pain, your injury. And so that's a great thing about Michigan, is you do not need a referral for physical therapy. So appreciate everyone that checked it out and was watching today. If you have any questions, again, feel free to comment below, and I'll be happy to answer them. If you know of anyone that would benefit from this, tag them below as well so that they can check it out. And also, if you don't mind liking it or sharing it as well, if you found it beneficial, that'd be great. So I'm going to plan on doing this every Monday at about 8 p.m. We're going to bring on some guests in the future as well. So really looking forward to that and seeing what comes of this. So thanks again, everyone, and have a good rest of your Monday night.